Yeah, so thanks for joining us today. Really appreciate it. It's been a it's been an interesting road to get to where we are today, but I am confident in the Police Bureau's approach and where we've landed in terms of an operational plan to be able to implement the intent of the legislators with House Bill 4002. Appreciate the opportunity to work with our partners, Sheriff's Office, DA, Parole and Probation, Multnomah County, the chair, et cetera. Certainly has been challenging, but that's because it's a big deal. It's a big transition for us. So just kind of give you an idea about the direction I've given to the membership. First of all, we are committed to participating in the enforcement of the new law. I have every expectation that our officers, when in those situations, when time allows, are going to be able to take appropriate action, whether that be associated with deflection or custody to jail. Now, the caveat of that, of course, is we always prioritize life safety first and foremost. And we know that there are many competing interests for our officers' time. And it will be a learning process for all of us in terms of how we're able to prioritize these calls in these various situations. And that is still to be seen, but it is absolutely imperative that all of us participate. And if in a situation where we encounter somebody who's in possession of illegal narcotics, that we take the appropriate steps. And I'll just give you an idea of what that looks like. I'll use myself as an example. If I am, smoking fentanyl in front of a business, an officer comes upon me, will take me into custody for the charge of PCS. That's the, charge that was around for years prior to 110. So I'll be taken into custody, handcuffed, searched, identified, all as if that arrest is happening, and in a very traditional way, that whether we're arresting somebody for theft, vandalism, whatever it might be. In that process, the first thing we want to do is we want to make sure that we're sensitive to the medical needs that may be present with this individual. We do that routinely, but I highlight that because of the acuity associated primarily with fentanyl. And we know it's not going to be just fentanyl. We'll obviously encounter methamphetamine, heroin, other narcotics, but the acuity around fentanyl is very severe. And we want to make sure that we are paying attention to the medical needs. And so we will do that evaluation, and obviously if there's a medical issue, we'll address that as we've done in the past, call AMR, call for fire to support. But assuming that there's the person stable and we're comfortable with that, we also need to double check and see if they have any kind of supervision. Are they on parole or probation? Because we've taken them in custody for a charge of narcotics. We want to make sure that their supervisors know in the Department of Community Justice that this has happened, and then they can make a determination. They might decide, a parole or probation officer might say, hey, we want this person actually taken to jail because they haven't been checking in, or this is a violation of their parole or whatever. So that may divert them to jail because of a decision that's made by parole and probation. Excuse me, this is not uncommon to what we already currently do with other crimes. So it's baked into the process. But assuming that they either don't have any warrants, parole and probation is fine, whether they're on supervision or not, then the next thing is we will, after we've evaluated, if we have just the PCS charge, and this includes up to an A misdemeanor, and the reason I make that distinction is because what the legislature changed to make those narcotics illegal again at the lowest possible amount is a different misdemeanor. So you have a C misdemeanor up to an A misdemeanor. We didn't want to get into officers having to weigh and distinguish between whatever amount it was. So as long as it's within that misdemeanor charge of possession of a controlled substance, and they don't have any warrants, and they're medically stable, they're not violent, all these conditions are met, then we'll give a call. We'll ask the member, we'll ask the individual, hey Bob, do you want to participate in this program known as Deflection? And right now, because there is not a location to take people to, we'll get on the phone and we'll call the Deflection coordinator and say, hey, we've got Bob and we want to know if he's eligible. And they'll know if he's eligible, if he has been participating in the deflection process, or if or if not, if I've not been participating in it. So the county will be responsible for designating and telling us whether or not they're eligible for deflection. If in fact I'm eligible for deflection, then they will connect us with a mobile response team, a behavioral health specialist. And we've agreed that we will wait up to 30 minutes for one of them to respond to the scene. They're going to be strategically located across the city, between here and into East Portland and all the way out into East County. So my preference was 15 minutes, but I think 30 minutes is more practical, which means our officers will maintain, this person will maintain in custody, in handcuffs or in a police car until the behavioral health specialist arrives. At that point, we're all in agreement, they're deflection eligible, the behavioral health specialist is there, then we'll release them. From a law enforcement standpoint, we're removed from the situation, and the behavioral health people take over and do their screening, so forth. You'll have to get into more details with them about what that looks like. It's important, a couple things. One, officers are still going to be writing reports. We're going to be documenting all of this. We've created a form that's going to be helping us gather information in terms of, you know, whether they met the criteria or not, what the response time was, et cetera. If the behavioral health people could not be there within 30 minutes, we're going to go to jail. We're not able to just wait around. If circumstances come up that are really significant, and we haven't clearly identified those, but I trust the judgment and the discretion of our sergeants and our officers, there may be situations where we just need to issue the person a citation and release them because we have another emergency to respond to that's of a higher priority. Officers will always have that discretion, sergeants will always have that discretion in the field. If they're not eligible for deflection, they're going to go to jail. If parole and probation wants them to go to jail, if it's outside the hours and nobody's available, then it's my expectation that they'll also go to jail. And then, you know, the final piece being that, once again, these are people that are highly at risk given their behavior. And I've made very clear to all of our constituents that there's risk involved with using law enforcement now to step into this space that it has not been in for several years. And what I mean by that is the physical, taking people into custody, putting handcuffs on them. There's a high likelihood there will be uses of force involved. There's a high likelihood that people may have medical conditions that could, you know, lead to serious reactions, maybe even death in custody that we cannot anticipate because of all of the unknowns associated with illegal narcotics use. And I just want to be really clear that we all have our eyes wide open, that we are doing our best to interdict into a space with our community that we believe is in the best interest of both the individuals that are participating in this drug use as well as the overall sentiment of the community. But there are risks involved, and we will do everything in our power to mitigate those. We will continue to be consistent with our policies, our procedures, our oversight, our documentation. None of that's going to change. We will, you know, with the use of body-worn cameras, we're going to be able to have lots of material to review and see. And this is going to be a work in progress. You know, this takes off on Sunday, and it's going to be a work in progress. And we will probably identify gaps in the system very quickly. Cops, if nothing else, are very innovative and creative in terms of being problem solvers, and I'm confident that we will probably be making adjustments as early as the middle to late of next week. But right now, that's the direction that we're giving, and you know, we intend to do everything we can to make this successful, both for the individuals that we're contacting, for the community, for the organization. All right. Michael, does that do it, or you want to just go to questions? Okay.
Yeah, go ahead. Chief Noel Crombie with the Oregonian. If one of your officers encounters someone who chooses deflection and they go off into that part of the system, what happens if that person, you know, they've got a certain period of time to meet those requirements? What happens if the police officer encounters that person again, perhaps again, and even again, in that 30-month window? What are the options for the police officer at that point?
Yeah, that's going to be one of the things we're going to work out, right? We had a lot of discussion about how many times are you eligible for deflection? What does that look like? So right now we're saying, you know, you have this 30-day window. So let's put me back on the spotlight. It's the first I get contacted, I get taken into custody, and guess what? Bob's eligible for deflection. So I go off to deflection. And 4 days later, I'm getting contacted on the street again, I'm taken into custody, and they call up. And what they're gonna be told is, hey, you know, either Bob is participating in deflection, but you know, they have time to get, they have that 30-day window. So it could be that, you know, they're like, oh no, Bob's still eligible for deflection, even if I haven't followed all the steps, because they give them time to be able to participate. Somewhere in here, and this, I don't have a number, but somewhere in here, common sense has to prevail, right? If it's, you know, every 2, 3, 4 days, we're contacting the same person over the course of a 30-day period, then, you know, my direction's gonna be that we need to take that person to jail. That this isn't changing the behavior. But right now, I'm willing to participate in this to see how that works, to see what that looks like. But I will be the first to come back to the county, and, you know, the participation in deflection is encouraged, it's not a requirement. And I absolutely believe that arresting people to try and change addiction behavior is not the answer. But there is a role for interrupting that behavior. So if we are constantly taking the same people into custody, even if they are participating in the deflection process, that's not going to be sustainable, and we may have to go ahead and take them to jail just to be able to demonstrate that, hey, you know, we gave you this opportunity, but I don't know what that number is right now. Oh, I don't know, how does this work, Mike?
Thank you. Courtney with the Portland Mercury. So it sounds like the folks who are offered deflection don't have to enroll in a treatment program right away. They've got some time. Is that right?
My understanding, and this, I've been in a lot of meetings, folks, so I'm trying to give you the best of my knowledge, but so I would hate for this to be the headline. But my understanding is, yes, they have 30 days to engage. So we may enroll somebody in deflection on Sunday, which is to your point, Noel, that you know, it could be we enroll them into deflection on Sunday, the 1st, and they have until the 30th to really engage in all that. So the 1st to the 30th, we're going to be watching really closely, you know, how many times there's that interaction, what's going on, how they're responding, et cetera. Does that?
Yeah, Claire.
Just to follow up, I asked that because we know that people who are in the throes of addiction, you have like a few like less than 24 hours to get them into treatment before they change their mind and relapse. So how does that work? Because someone may say, yeah, I want treatment, and they're going to change their mind almost immediately within 24 hours later. They're going to go use again.
Yeah, and I think I would agree with you, but that's way outside of my lane in terms of expertise. So, I mean, that's really going to have to be to the county and to the behavioral health specialist, you know, and frankly, that's the benefit of going to jail, is that jail has, you know, teams of people, medical, et cetera. There's a place, there's a, you know, a kind of a immediate accountability measure. But, excuse me, we also know that there's also, you know, drawbacks and challenges to that.
Claire, before you go, let's keep the questions to what our role in this is, and if you have questions for the county, you gotta go to the county. We can't answer county questions for you guys.
I can speculate, but that's never going to be helpful. Who's next?
Claire Rush, Associated Press. So when police encounter someone who has a small amount of drugs on them, they will be placed under arrest. The deflection program isn't an alternative to arrest. They will be arrested, and then police will call this behavioral health peer team, and they will come and either take them to or meet with them in the field, and then once the temporary drop-off center is opened in October, they'll take them there.
Yeah, so let's be clear on a little bit of terminology. When I'm talking about putting them under arrest, they are under arrest. They are in custody. They're not free to go. They will be handcuffed. You know, that is an arrest. Now, as with all of our cases, there's an opportunity to work through that arrest process. You know, we take people into custody at times, and then throughout the process realize, okay, we're not going to charge them right now. Maybe we're going to charge them later, and we can release them. Or we need to take them to another location to do, you know, a show up because maybe they're a suspect in a crime or whatever. So, you know, they are in custody and they're our responsibility. But then we also have the ability to say, okay, well, we've now chosen to go with deflection. You've chosen to engage in deflection. We've chosen to make that available. And then we can unarrest them and they would no longer be in our custody. I feel bad because you're on the end and, you know, we're kind of going this way, so I'm
That's
gonna...
all right. Emily Gersh with K2 News. Thanks
Yeah.
for having us today. So when the mayor's camping ordinance took effect, PPV was not aware that the sheriff's office would not book violators of the ordinance. How have you been working with the sheriff's office, communicating with them to make sure that violators of this, if taken to jail, will actually be booked there?
Yeah, so sheriff's been in all these conversations. I sat with her, what's today, Friday, Wednesday, so she's well aware. And of course, you know, it's going to impact her deputies as well as, you know, Gresham PD, all agencies in Multnomah County. So we've been very much engaged in that, but we've also made a commitment to communicating. If there are times, you know, we do, many times we'll do strategic enforcement missions around, whether it be retail theft or street takeovers. Now as well, we've been doing some around fentanyl use and drug dealing. Now it's going to include possession. So I'm committed to communicating regularly with the sheriff's office so they know ahead of time, hey, if we think we're going to see an increase in number of arrests, you know, they can be properly staffed. We're doing that as well with the behavioral health specialists. So, you know, I don't want to overwhelm the system. I don't want to try and break the system. We're definitely going to be engaged with it, and we'll probably pressure test it because we will be the biggest users of it. But yeah, we're communicating regularly on this one.
And then
for
one
sure.
more, in City Council on Wednesday, you expressed some concern that the county's deflection program, that there's no one leading it currently. And Commissioner Mingus Maps was asking, you know, who's in charge of this? You know, we know that the center was supposed to open September 1st originally. It's now going to be open in October. It's going to be a mobile program until then. Can you provide information about how this program is going to work on the first day?
That's more of a county question.
Yeah, I mean, our part of it is, we've been told, we have a phone number, we're gonna call it. And if they're not able to deliver, they're not able to participate, the person's gonna go to jail. So
Well,
that's
okay.
the best I can do right
And
now.
then if it gets to the point where the jail fills up, have you thought about that?
Yeah,
What would happen in that circumstance?
yeah, so we'd have to, once again, talk to the sheriff about that, but at this point, you know, through the booking process, you know, she's confident that we're gonna be able to handle that at this point. We don't really know what the numbers are gonna look like. All of this is gonna be an adjustment in terms of how many people are taken in custody, how many people choose deflection, how many people meet the criteria. The criteria is very narrow to meet deflection, right? No other charges, no warrants, no violent behavior, medically stable. I mean, this is going to be a very, very narrow window. I have low expectations that we're gonna see tons and tons of folks. We may see more people taken into custody, but, you know, we're gonna probably end up finding additional things that are gonna associate with them.
Before we go to Blair, circling back real quick to your initial question, the difference with that TPM deal is that was a city code, and so there's thoughts out there that, you know, the sheriff didn't book for city code. This is ORS though, so there's a big difference there. I mean, the expectation is.
She's been taking state statutes, the county's been taking state statutes for a while now.
Every expectation of these folks we
Yep.
book. Blair.
So there are clearly some holes in this. Deflection's only offered certain days, certain hours. If a peer support specialist doesn't show up in 30 minutes, they get arrested. Can you speak to the unfairness of that?
Yeah, there is certainly a lack of equity in that. But I would argue that it's not necessarily uncommon. I'm not saying it's right for the, you know, system, but historically, particularly when we attempt some of these new programs, just because of capacity and ability, years ago, we did a similar model that we took from Seattle. You might be familiar with LEAD, Law Enforcement Assisted Diversion. So we attempted that here in Portland many years ago, and I'm testing my memory, so please feel free to double check my work. But same kind of deal. We trained a limited amount of officers and used it in a limited amount of time to see its effectiveness. So essentially, people who were contacted by those officers were given, you know, an opportunity that others were not. It was important to me in this process, from a PPB standpoint, that we apply this, you know, consistently. There was some talk about, well, the bike squad really encounters most folks in this, so let's just have the bike squad do it, or let's just have our neighborhood response team do it, kind of try it out. I said, no, to be responsive citywide, this applies to all of our patrol officers. But then the county, you know, needs to figure out how to meet that demand, and right now, the best they can do is between 8 to 8. So there is a challenge there, and it has come up, and we'll see once again how the numbers shape up. It might motivate to get the resources in place sooner to make it 24/7.
I want to go to Joelle and McKenna and Connor if they have questions, because we only have a few more minutes. I want to give everyone a chance to at least ask one, so we'll go ahead.
Thank you. Joel Jones with Queen 6. My question is about the ID and the information that officers are going to be taking in. We know a lot of these people are going to be under the influence, some of them homeless without ID. How are officers going to be tracking who they're taking into this deflection program?
Right, so it's our position, we're not going to put somebody in a defection program that we can't identify. So, we have processes in place for that, obviously access to, the computer databases, LEDs, NCIC, et cetera. I haven't, been in a patrol car in a while, but I think we can pull up mug shots on screen, if I'm not mistaken, we can, is that right, Kevin? So, before we put anybody into the deflection, we're gonna know who they are, and we're gonna be able to confirm that. And if they are not willing to give us their name, or we're not able to confirm their identity, then we'll take them to jail and they'll be fingerprinted. And we do have the IBIS capability still in the street, so we do have the ability to take their fingerprints on the, test them on the street and then see, identify them. But I want to assure you, we're not going to put somebody in deflection that we don't know who they are.
Understood, because this sheet says, take the person's name, date of birth, and ID if available, and it continues to go through the steps of referring someone to deflection, so I'm
Yeah.
just curious as to why that if available.
Yeah, it might have said available for a couple things. One, somebody may not have physical ID on them, so it was probably intended to be, like take it so that you can give it to the behavioral health specialist or whatever, that might be the intent. But I've made it really clear internally that we're not putting people in deflection that we don't know who they are.
And there are numerous mechanisms to do that.
Yeah.
McKenna?
Thank you, McKenna Marks with KPTV. I spoke to local business owners just a couple days ago who are frustrated, scared, fed up with open air drug use, people using drugs quite literally right outside their restaurants or business. I know change is not going to happen, right after midnight on September 1st, but that may be a message from you to business owners, residents here about hopefully seeing some change coming soon.
Yeah, absolutely. I mean, the legislature gave us this tool to be able to address this issue, which the community has spoken loudly about, and I've probably shared some of the same conversations that you've had. I'm well aware of the frustration and the concern. We do need to set expectations in the sense that we continue to be challenged with the demand for service in a variety of areas for the Portland Police Bureau. With the amount of calls for service and the staffing and the utilization of our resources, we're always going to put life safety number one. That's always going to be our priority. So we're working with the dispatch center now so that when people call and that we can make sure that the call is properly categorized, and we've made it clear to our supervisors and officers on scene that they are to make themselves available and to get to those calls. If we're not, for whatever reason, able to, and Craig, correct me if I'm wrong, we're going to reach out to the people that are calling and let them know why, what's going on, and so forth. So if a business calls, and for some reason we're not able to get there, I want, the sergeant to be able to call them and say, hey, here's the situation, here's why we're not able to be there. I am going to ask for some grace and some patience. I fully expect there will be times when people will call, but the delay in our response, when we get there, the person will be gone, which once again is not uncommon for other calls for service, unfortunately. But that's a reality. But what I would affirm to the business community, and it's not just the business community, I hear from neighbors, people in their parks, people on the sidewalks. I mean, this is a community crisis that we're facing. And I think the change that was made by the legislature was in response to that, a demand from all of us that, hey, this is not working, this is not acceptable. So PPB is 100% committed to using all of our resources to try and interdict this and be responsive. And I will be closely listening and evaluating our progress. Assistant Chief Dobson from our operations branch is talking to the precincts every day about this. We're going to be gathering data. And as I said at the beginning, I wouldn't be surprised if, by Wednesday or Saturday of next week, we're adjusting to the demand, to the expectation. It might require a more intentional effort in ways we don't even understand.
Really
Final
quick.
question, and Conrad, then we got to let you go.
Chief Conrad Wilson from OPB. Could you talk a little about the resources? I mean, this new law is going into effect over a holiday weekend, Sunday, Monday, just from a police bureau standpoint, and also like your expectation of the deflection. Are there going to be people that are going to be showing up on Sunday
Right.
and Monday to deflect people that are criteria?
We were told yesterday there are going to be some behavioral health specialists available for limited time frame on Sunday and Monday. We're also,
8 to 8? Or,
I can,
or-
let me answer that real quick, and then
Okay,
I'll let
yeah.
you jump in. We are understanding that because it's a holiday and Monday's a holiday and Sunday is Sunday, 10 to 5 Sunday and 10 to 5 Monday, and then Tuesday we'll get back into that 8 to 8, Monday through Friday.
But what in terms of police resources are you gonna have on the
right,
ground on
right,
the holiday
yeah,
weekend?
right. So a couple of different things, what we're looking at. I mean, we're gonna have our traditional, response model, which is not adequate, but is what we're able to do at this time. And then we're having discussions internally about whether or not we're able to upstaff so that we can maybe spend some, specific time on this issue. I'm really anxious to get some data and some feedback to just see sort of what the scope is. I will tell you, particularly with our teams downtown, most of the people we encounter, they have warrants, they have other issues, a stolen car, or whatever. So I'm really curious to find out how many people meet this criteria and the benefit of it. So I'm not able to commit at this point whether or not we're going to have additional resources this weekend, but I have asked Assistant Chief Dobson to see if we can upstaff some a little bit to be
Sorry, what's
focused
that mean,
on this.
upstaff?
Just add to, just add to the staffing level.
So folks are waiting, there are other officers to respond, is that?
Yeah, this would be officers that we would use specifically to try and, determine, go out, make contacts, see what's going on, aside from taking calls for service. 99% of what our officers do on a day-to-day basis take calls for service, and, there's numerous calls holding at any one time. So when we want to make sure that we're addressing outside of that, we usually have to create that space, which means hiring extra officers on overtime or adjusting internally what we currently have, which then means some of those calls have to hold longer, so.
And
I have-
to,
We'll see.
to piggyback on that, because I think it's incredibly important, I've been sharing this message in community meetings I've been sitting in. I'm not, just for your knowledge, and I think everyone in here knows that Bike Squad does occasional missions, and we might do those down the road, but like every day, we're not, coming into work, heading out, and like we have other police work that still has to happen in the city. So just, we need to keep that in mind, that we're not, like every bureau member is not gonna be, going out every single day. Like we have police work to do in the meantime. Does that
Yeah,
make sense?
this is, go ahead.
I just have one more question on the resources. So PPB currently has 70 vacancies. You mentioned on Wednesday you expect another 20 to 25 retirements in November. The last time this law was on the books, there was at least 200 more officers enforcing it. You expressed some concern about what happens after arrest to the county. You expressed concern on Wednesday that the county wasn't ready for this. Do you feel like you have enough officers to do your part? And do you have confidence that the county will do its part starting on day one?
So, first of all, thanks for listening to my testimony on Wednesday, but that was a long 90 minutes. But no, we don't have enough officers. I mean, the reality is the police bureau, as you said, just as recently as a few years ago, had 200 plus more than we have currently right now, and the demand is high, and the expectations are high, and the challenges are real. So we do not have enough. What I am confident in PPB is I am just so impressed and pleased with the work that I see done on a daily basis, given those challenges in that environment. We see a decreasing amount of calls for service, and we're seeing a decreased amount of crime and reported crime, largely attributed to their work and our work with other community organizations. And that's true in many, many categories. So could not be more proud and more confident that the men and women that are being called upon this weekend to do the work will do the best to their ability. We will not be telling people there's nothing we can do. We will not be telling people, call the mayor's office or blame the chief. No, we are in unison that we are going to do the best we can. In terms of the county's piece, I'm not going to speculate. That's really on them. They've been in all these conversations. They do have a significant role in this. We are the starting point, and we are going to do everything we can to make this successful, but they've got to pick up their end as well.
All right, guys, we gotta let the chief go. He's got stuff going on.
One